We hear about new health trends all the time, special diets, supplements, exercise routines. But what if the real key to preventing and reversing chronic disease isn't found in a pill, but in how we live our everyday lives? Today, we're talking about lifestyle medicine, a powerful evidence-based approach that focuses on the root causes of illness and empowers us to take charge of our health. It's estimated that 80% of chronic diseases are linked to lifestyle choices. But what choices are we making that we should reevaluate? Joining us today is Dr. Amanda Marrone, a board-certified lifestyle medicine physician with nearly 2 decades of experience in family medicine and surgical assisting. Thanks for joining me today.
Thank you for having me.
So let's talk about what is lifestyle medicine and what makes it different from functional medicine.
Right. So lifestyle medicine is the therapeutic use of lifestyle interventions that are evidence-based, and they are aimed to both prevent and treat chronic diseases. And we do that by empowering patients with both knowledge and life skills, right? Habit changing skills in order to effectively target the root causes of disease. Because just like you said, 80% of chronic disease are rooted in lifestyle. So it's a little bit different from functional medicine, which, although there is some overlap, functional medicine focuses a lot on diving into the deep root cause of chronic diseases through a lot of investigations and testing. And then they use things like nutrition as well as supplements and herbal preparations to try to correct imbalances found in that in-depth testing to restore function. So it's kind of similar, but in lifestyle medicine, we really focus on a coaching approach to medicine where we are looking to bring patients alongside us to make effective changes.
Okay, so how does lifestyle medicine work alongside traditional medicine?
Yes, so in no way, shape, or form is it meant to replace or shun conventional medicine. Ideally, the two should work in synchrony. And in fact, I feel that lifestyle medicine should be the foundation of conventional medicine. And unfortunately, traditionally, in medicine, and I was trained in the conventional system, we're focused at chasing disease after it's reared its head. And we don't focus on prevention in the way that we should, right. Because if 80% of chronic disease is linked to lifestyle, then prevention doesn't happen in a lab with testing. It doesn't happen in my office. It happens in patients' homes with their habits. And so that's where we really need to focus our attention. And we need to help people make change, which is not always easy.
Well, many people think of healthy choices as just diet and exercise. Yeah. What else do we need to consider? You talk about 6 pillars.
Yeah, there are 6 pillars we focus on in lifestyle medicine. So we do have nutrition and physical activity, the big ticket items, but we also have stress management. We have sleep hygiene. We have substance avoidance and social interconnectedness. And the important thing to remember is that all the pillars are equal and of equal importance. And if you ignore even one, you can, develop disease.
In some ways, this seems so simple, but, in practice, it really isn't, right?
No.
I mean, what's your advice for making these improvements a part of our lives? There's a difference between perfection versus balance and improvements, right?
Yeah, that's right. Trying not to do everything at once, give yourself a little grace,
right.
And recognize that there is no need for perfection. In fact, making small changes, throughout time really is the key to doing it sustainably, because anybody can make a change for 30 days, but the key is to change your whole habit, their whole way of thinking. And so that is where a mindset change has to come into play.
Now we have about 45 seconds left. What do you say is the biggest challenge in people trying to embrace these new changes? Because, sometimes we just either don't want to, or we find it difficult, or habits are hard to break.
Yeah, the biggest challenge is getting, because our habits, they serve a purpose for us. And so that they give us something. And usually it's to steer us away from things that make us uncomfortable. And
Right.
so it's really hard. And sometimes they're rooted in culture.
Mm.
They're rooted in your social connectedness and your social interactions. So it's important to get people to come to a place of recognizing what role those habits have to play, and then how you can move forward from them and replace them with healthier habits.
Well, stay with us. We'll get into it right after the break.